Okay, so good morning, everyone. Thank you for giving me the opportunity to present. So these are the disclosures pertaining to my lab and PI. I personally have none to disclose. Enhanced recovery protocols are a set of standardized perioperative elements that have been extensively explored in colorectal surgery. Multiple randomized controlled trials in this field have proven its benefits in terms of decreasing length of stay, healthcare costs, and post-operative complications without a rise in hospital readmissions. However, the literature shows that simply establishing a protocol is insufficient and more efforts are required to maintain its sustainability. Many studies have underlined the importance of having high rates of adherence to ERP elements to achieve better post-operative outcomes, whereas poor adherence has been proven to have increased morbidity and longer hospital stay compared to having better adherence. Therefore, improving adherence remains a target of care for quality improvement. In a cohort study by our group, factors influencing adherence to post-op ERP elements have been studied in laparoscopic colorectal surgery. The study differentiated between elements that required patient activation or patient participation versus those that were led primarily by the clinical staff. It was noted that predictors of adherence has differed between the two groups of patients, with lower adherence being observed in the ERP elements that required patient involvement. So how can we improve that? Healthcare providers have recognized the importance and urgent need to empower and equip patients with knowledge regarding their health to allow them to take an active role in their care. Patient activation has emerged as a vital indicator of patients' ability to cope with their disease and treatment. It is defined as knowledge, skills, confidence, and behaviors for managing one's own health. It has been associated with healthy behaviors, better disease control, and positive outcomes for patients who have chronic diseases. However, for patients in the surgical group, there is limited data regarding patient activation. Patient activation is measured through the PAM 13-item questionnaire with an overall score that ranges between 0 to 100. It has a hierarchical structure with the overall PAM score that stratifies patients into 4 groups or 4 levels of activation, with the lowest being stage 1 or level 1, they're passive recipients of care, and in the final stage, which is level 4, patients have adopted new behaviors, however, they may not be able to maintain them under stress. In the surgical literature, previous research from our group showed that patient activation is associated with post-op outcomes, such as if they had a lower level of activation, they would have more emergency department visits and admissions, as well as 30-day complications. However, it remains unclear whether increased activation is associated with improvements in care processes, such as adherence to ERP elements. Now, to bridge this gap knowledge, we describe our primary and secondary goals in this slide. So we primarily assess the extent to which patient activation is associated with adherence to ERP elements for colorectal surgery, with a focus on active and passive elements. And in our secondary goal, we're assessing the impact of active and passive adherence on the length of stay, 30-day complication, readmission, and emergency department visits. So this is a secondary analysis of a multi-center prospective cohort study in colorectal surgery at 2 university-affiliated hospitals in Montreal, Canada, where all patients in their perioperative care, it was done according to the current enhanced recovery guidelines. Adults aged 18 and older undergoing elective colorectal surgery were considered for inclusion. We have excluded patients who were discharged the same day, as well as other exclusion criteria. So the survey was completed 2 weeks prior to their surgery, where patients have answered the PAM questionnaire. And we have our cutoff here, which is low PA being less than equal 55.1, high PA is more than 55.1, and this cutoff was defined in previous literature. So all patients were managed with an enhanced recovery protocol. Prior to admission, they have received a written information to reinforce their role in the pathway to promote their engagement. They would have daily recovery goals and milestones. In this present study, we had 15 ERP elements that we have also classified into 2 groups, those requiring active patient participation and those that are mainly driven by the healthcare team. And adherence in this study For each ERP element, it was defined as the successful completion of a planned intervention, and the overall adherence for each element was calculated as the percentage of the total elements successfully completed. So we have used the linear regression to assess our primary outcome, and logistic regression was used to assess our secondary outcomes, and multiple imputation was used for missing data. In our regression analysis, in addition to patient activation, we have accounted for other predictors of outcome that are displayed in the screen. So a total of 286 patients were included. The mean age was 59, 55% of them were males, 53% had a diagnosis of colorectal cancer, 62% were approached laparoscopically, 21% had new stoma creations, and the median length of stay was 4 days. Most patients in our cohort had a high level of activation, 74%, and in this exploratory univariate analysis between the two groups, high patient activation had overall improved outcomes, including the length of stay, the emergency department visits, readmissions, and complications in comparison to the lower patient activation group. So the overall adherence in our study between the two groups was 86% for all the elements. And with respect to the active element, it was 77%, and for the passive element, it was 81%. So for patients in the high activation group, they did have higher adherence to all elements, as well as active and passive, in comparison to the low activation group. So in our primary analysis, among the factors tested as potential predictors of adherence, it was noted that high patient activation was significantly associated with mean adherence to overall as well as the active elements, but not to the passive elements. In our logistic regression analysis that we have focused for our secondary outcomes, increased mean adherence to active ERP elements was associated with reduced 30-day complications as well as reduced 30-day readmissions. So as a take-home message, patient activation is a modifiable factor. And from what we have noticed in our study, that high patient activation is associated with increased mean adherence to active ERP elements. Pre-op identification of patients with low activation may inform the implementation of interventions to optimize patient involvement with enhanced recovery protocols and improve post-op outcomes. Thank you for your attention, and can take any questions.